Good morning, everybody. 9:30, we'll call the meeting to order. Is there any disclosures of interest? None noted. Any additions to the agenda? I do have a little more here. Okay. Presentations or deputations. Yes. Okay. Bernie's mentioned two items he has under other business. One relating to doctor availability, the other relating to housing. So we'll deal with the previous minutes on page 3, Health and Social Services Advisory Committee meeting from April 25th, 2022. A motion. Councilor Corbett, seconder. Sir Huffman. All is in favor of that motion. Read those minutes. Thank you. The update on those reports, Heidi.
Mr. Chair, all of the reports were approved as recommended by Advisory Committee.
Okay, thank you.
Mr. Chairman, can I ask, I think, what we went through in Cuba with regard to social housing, the sales of the property, did that go through council or what's the steps? I don't understand.
Sorry, Mr.
Thank you.
We'll move on to staff reports. First one from the general manager. Heidi, do you want to address committee with any issues at this point, or should we move on to Dr. Strauss? Okay, we'll deal with our report from Dr. Strauss on page 8. Morning, Dr. Strauss, go ahead.
Good morning. Thanks for having me. Sorry I couldn't be with you in person today. So my report is rather brief, and I feel like it's very similar to my report from last month. I think last month I said that the sixth wave had crested. This month I'm comfortable saying the sixth wave in Ontario has concluded. So hospitalizations in Hull and Norfolk are markedly down. I don't have numbers from this morning yet, but as of Friday, there was just one COVID positive individual in the hospital, and that person was not in ICU. As the committee knows, I personally review every case of a death in a COVID positive individual. So over the last, I would say 3 months, the majority of deaths that have occurred in a COVID positive individual have been determined to be not due to COVID. And those deaths that have been in the judgment of the physician providing care for that patient, those deaths that have been due to COVID have by and large occurred in individuals who were nearing the end of their life and were receiving palliative care due to other conditions, which is all of that is to say that the vaccines work. We have the vast majority of vulnerable individuals vaccinated in our community. And for those who aren't or who are high risk on some other basis, there's now excellent antiviral treatment. I spoke with one physician in town who's prescribed Paxlovid to over 25 patients just in the last few weeks. So it's that very important medicine is getting to patients who need it. I did want to show a graph. I didn't include it in my printed report. I kind of this morning realized it might be important to share. So I'm going to flip to my to share screen. I actually have two graphs that I wanted to show you. So there's a lot of talk. Can everyone see that? I can't see if people are nodding or not. I'll try again. Oh, sorry, everyone. So this is daily deaths from COVID-19 in the world per million population. I believe I showed a similar graph last month, and that very positive trend that we talked about persists, that total world COVID deaths are down, and they're down to a rate that has not been seen since March 2020 when the pandemic was called. There's some ambiguity about when a pandemic is called off. The technical definition of a pandemic means an epidemic over most of the globe or much of the globe. And an epidemic means that there are more cases than you would expect. So when an epidemic is over is somewhat dependent on what your expectations are for what cases will be. And I think it's clear that COVID will always be with us. So there always will be COVID cases. It's when this line gets low and flat that we can say with confidence that the pandemic is over. But it sure looks to me, based on this graph, that it is ending. And then the other thing to show is that this trend is visible in our province just as much as it is in the world, just as much as it is in Hallam and Norfolk, that this sixth wave has come down. These are hospitalizations in Ontario. So on all that basis, I'm pretty confident saying we're just about at the end of this, and COVID-19 is receding as a public health concern. It will always be of some. It will always be, just as flu is, of some measure of public health concern, but it is receding in terms of the priority list. So I had mentioned in my report that there are some other concerns that are on our radar. These are severe acute hepatitis in children. There was I've neglected to put this in the report. There was a case of whooping cough, Bordetella pertussis, in our community over the last month in an unvaccinated child, and that's of grave concern. It has long been the case that our unit has had lower vaccination rates than some other units for all diseases, all childhood vaccinations. And unfortunately, throughout the province, there's been a decline in those vaccinations in children over the last 2 years as COVID, I think, has sucked all the oxygen out of the room in terms of prioritization and just what has been possible. Monkeypox is top of everyone's mind. We're making plans, communication strategies, consideration of vaccination strategies for if that outbreak becomes epidemic. And then we are also monitoring bird flu, which there have been many cases of in the United States, quite a few in Canada, none in Hallam and Norfolk so far. So I don't think we want to go into great detail into each of these potential concerns, given that with the exception of pertussis, there have been no cases of the other three in our health unit, but that should at least give you a flavor of some of the things that the health unit is monitoring and planning for. And I'm very happy to take whatever questions you have.
Thank you, Dr. Strauss, for your presentation. Are there any questions? Have Councillor Hoffman, then Councillor Corbett.
Thank you, Chair Del Monte. Through you to Dr. Strauss. Are there any plans through our health unit to do any more advocacy for childhood vaccines to get our rate up in the area?
We are always advocating. If you bump into any member of the health unit, you're likely to get an earful about the importance of this. I think that the major difference in terms of why rates are declining, not just in our health unit, but across the board, is not so much for lack of advocacy. It's been logistical difficulties that schools have been on and off closed. Our vaccinators have been busy vaccinating for COVID-19. So I hope and I do expect that as we just get vaccinators back into schools providing these vaccinations, that things will pick up again in terms of vaccination rates for childhood diseases.
Corbett?
Yes, doctor, this may not be in your area, but I find after so many years that a doctor I've had for about 52 years has decided to retire early. Getting a letter indicating I'm retiring, as well as about 2,000 or whatever their practices in our community. Nobody in our community, none of the doctors are taking patients. What would you suggest for us?
I think that, so it is known that, well, two things are known. One is that we in Halden and Norfolk have a lower rate of physicians per capita than the rest of the province. That's been a long-standing problem. It's a big problem. The other thing that is known is that on account of the last 2 years that everyone has had, I think not just healthcare workers, workers in all fields are burnt out and many are choosing retirement early. So I do anticipate that this is going to become more of a problem, I'm sorry to say, and it is of public health concern. It is not within my power, let's say, to fix this problem. There is, and I think if we as a community wanted to deal with that problem, there's a lot more planning and work and consideration that would have to go into it than an off-the-cuff remark from me today. So I think if committee members, city councilors, board of health members want to start discussing that perhaps offline and raising that as a priority, I think that would be a really good idea. And I'd be happy to facilitate and convene some of those discussions. But I think I'm sorry to hear that you're left a little bit in the lurch. Personally, or through the chair to Councillor Corbett. But I think you raise a really important problem that probably needs a lot of consideration and frankly a lot of work to fix. So I don't have a pat answer to give you today.
Thank you. The difficulty comes for a lot of people, like where do I get blood checks done with no doctor giving me that information, and we do it regularly. Diabetic has that blood check. In addition, just the prescriptions you get. What do you go to walk-in clinics and wait half the day to be seen?
Through the committee chair to you, Councillor Corbett, that is unfortunately what one is left with when left in that sort of situation. Urgent care, emergency rooms. I'm a specialist physician. I'm not a general practitioner. It's sometimes the case when that happens that specialist physicians, if you are hooked up with a specialist, they don't like to be providing primary care. They're not as good at it as folks who have specialized in primary care. But sometimes if you have a specialist, they can bridge some of the gaps. But unfortunately, our healthcare system in this province and throughout the country is predicated on folks having a family physician. And for a long time, that has not been a reality for a sizable proportion of Ontarians. That is it's a really big provincial and national problem. I think we could work on some strategies to improve it locally. But there just are not enough physicians being trained, and it is difficult to attract. It unfortunately is the case that I went to Western, but a preponderance of my med school today, of my med school class now, is in Toronto. So it's hard to attract folks out to remote and rural. I mean, not even remote and rural. Cambridge, Ontario is neither remote nor rural, but also suffers from the same problem. So my suggestion is let's talk offline, and I'd be very eager to see what we can do about this problem, but it'll be months, if not years, of work to ameliorate things.
Thank you.
Any other questions for Dr. Strauss? Thanks very much, Dr. Strauss. Enjoy the rest of your day.
Thank you all.
Okay, so we'll move on to staff reports. On page 9 is the vector-borne disease program update for 2021-2022 as HSS 22017. Eddie?
Good morning, Mr. Chair. I am pleased to introduce to committee Alexis Winbean. Alexis is the program manager of the environmental health team for the Haldeman Norfolk Health Unit, and she is going to present this report this morning. Syed Shah is on the line as well to assist with questions if need be. So I'll turn it over to Alexis.
Good morning. Through the chair members to the committee, I will be presenting the vector-borne disease program update for 2021-2022, HSS 22-017, and that this report be received as information and that the Board of Health supports the Haldeman Norfolk Health Unit's vector-borne disease activities, including active surveillance and education for prevention strategies. This report provides information about the Haldeman Norfolk Health Unit's comprehensive vector-borne disease program that is in place to monitor local tick and mosquito populations for diseases such as Lyme disease, West Nile virus, and Eastern equine encephalitis. This report highlights the public health initiatives that encourage the public to take preventative measures against tick and mosquito bites. Furthermore, there is a discussion of vector-borne disease program activities in the previous year and an overview for plans for 2022. Vector-borne diseases are human illnesses that are caused by bacteria, viruses, and parasites. These illnesses or infections are transmitted to humans by vectors such as mosquitoes, ticks, flies, sandflies, and fleas. Mosquitoes are known to be responsible for transmitting the majority of vector-borne diseases. The vector-borne disease specifically addressed in this report include Lyme disease, West Nile virus, and Eastern equine encephalitis. Lyme disease is an infectious disease caused by the Borrelia bacterium that is transmitted to humans by bites of infected deer ticks, black-legged ticks. The most common signs of infection is an expanding area of redness on the skin known as erythema migrans or bullseye rash, a week or so after a tick bite from an infected tick carrying the Borrelia bacterium. In 2021, the Haldeman Norfolk Health Unit did not identify any new risk areas. Due to ongoing COVID-19, tick dragging did not occur during 2021. There were 26 cases of Lyme disease in Haldeman Norfolk Health Unit compared to 7 in 2020, and 24 of those 26 were in Norfolk County. In 2021, 1,597 cases were identified in Ontario, up from 1,159 in 2019 and 809 in 2020. Weather and related warmer temperatures are expected to increase the incidence of Lyme disease through increased tick maturation rates and a longer available season of transmission. West Nile fever is an infection by the West Nile virus, which is typically spread by mosquitoes. West Nile virus is mainly transmitted to people through the infected bite of a mosquito through birds that carry the virus. In total, there were 121 pools of mosquitoes tested for West Nile virus in 2021. None of those mosquitoes tested positive for West Nile virus. Similarly, there were no West Nile virus positive mosquito pools identified in 2020 as well. Provincially, in 2021, there were 105 positive mosquito pools identified in Ontario, compared to 171 in 2020 and 71 in 2019. In Haldeman, Norfolk, there were no human cases of West Nile virus identified in 2021. There were also no cases identified in 2020 and one human case in 2019. In 2021, there were 23 reported cases of West Nile virus in Ontario compared to 77 in 2020 and 19 in 2019. Eastern equine encephalitis is also known as sleeping sickness, and it is a disease that is spread to humans and horses by mosquitoes. No human or equine cases of Eastern equine encephalitis were identified in 2021 within the Haldeman Norfolk Health Unit, which was also the case in 2020 as well as 2019. Provincially, in 2021, there was one case of Eastern equine encephalitis identified. This is comparable to 2 cases the previous year and down from a total of 7 cases in 2019. Eastern and equine encephalitis is influenced by temperature and precipitation, therefore activity will vary yearly. Additionally, there is a vaccine available for the equine population, which influences the number reported each year. The Haldeman Norfolk Health Unit will continue our efforts to increase public awareness about vector-borne diseases in 2022. The environmental health team will be working with the communications department to ensure delivery of educational messaging through radio, social media, newspapers, the Haldeman Norfolk Health Unit website, and smart TV ads. The health unit is also working with the county's parks departments to ensure availability of tick warning signs to tick-prone areas, as well as local hospitals and physicians to increase awareness of the potential for Lyme disease infection in the area. The Haldeman Norfolk Health Unit will also continue to develop promotional campaigns to raise awareness and build supportive environments to prevent and mitigate mosquito bite exposures via social network messaging and the Haldeman Norfolk Health Unit webpage. In conclusion, the vector-borne program will focus public health services required to protect the health of the community. The key is education of the community with the goal of minimizing the likelihood of exposure to mosquito and tick bites. And with that, I will be happy to turn it over for questions. Thank you very much.
Thank you, Alexis, for your report. Questions to the committee of Councillor Corbett.
Thank you for us report. Some name diseases I even begin to pronounce. My concern is ticks and Lyme disease. And understand there's going to be a bumper here for ticks. You mentioned something in the educational program posting throughout all of the Norfolk on parks and other areas. What are we going about education with the numbers increasing compared to Lyme disease?
Thank you. Through the chair to Councillor Corbett, we will be doing education through social media and media releases as well. We feel it's important to make sure that people are aware of where the ticks are in Haldeman, Norfolk, and it is they are very prevalent here. All of Haldeman, Norfolk will be identified this year, I'm sure, as risk areas for tick bites. We are focusing on social media to essentially educate younger individuals who might be out and about going through forests, trails, activities, and we are also going to be releasing signs and symptoms of an infected tick bite for Lyme disease as well. We are also going to be providing healthcare practitioners educational material as well to increase their knowledge on how to identify and better deal with Lyme disease in our area.
Thank you very much.
Any other questions? Councillor Van Passen?
Yes, thank you, Mr. Chairman, and through you, be a bit of a follow-up to Councillor Corbett's question, but I read through this report and I see the word endemic a few times. So why are we taking the time to go and drag areas to try to catch ticks, and why are we catching mosquitoes? Why would we even put any effort in that? They are all over. It's not a geographic location, I don't think. It's more so the type of area you're walking through. Like you're walking across an open field, you're not going to get any ticks. You walk through a grassy meadow, you're going to get them. If you walk through a dense forest, you're going to get them. So why do we even put any effort into catching them, testing them, doing that? You know, I think all the effort should go into that education part. And is it even possible to take it one step further and have the medical officer help sort of develop a protocol for the doctors on how to treat it? Again, like you know, they take blood tests, send it away, send it to get sampled. When there is a solution out there that if you get a tick in you, you get the one shot high dose penicillin right away, and then you don't have to worry about whether you've got it because you won't get it. Again, wouldn't that be a better method than spending our efforts counting ticks and testing ticks and all that? Just teach the people how to deal with them.
Through the chair to Councillor Van Passen, while we understand that Haldimand Norfolk is endemic for Lyme disease and these ticks, it's still a requirement from the ministry to do surveillance. It is also good for informational purposes to know exactly when we're doing tick dragging if we are getting any of these black-legged ticks that are showing up positive for Lyme disease. So while I understand your concern, and it is a valid concern, it is still a requirement from the ministry that we do the surveillance, tick dragging and mosquito trapping for the West Nile virus program as well. That is a requirement of the ministry.
Thank you. That's the clear answer I was expecting, that the ivory towers in Toronto kind of dictate to us in the rest of the countryside how we got to do things because they don't know how to close them.
Thank you.
Further questions for Alexis on this report? Not, then I'm going to deal with the motion on the top of page 9 of the agenda. Can I have a mover? Councillor Huffman, seconder. Councillor Patterson. All those in favor? It is carried unanimously. Move on to the second staff report, HSS 22018, and it's in regards to safe voluntary isolation sites program.
Mr. Chair, Alexis is going to present this report as well.
Okay, thank you.
Through the chair to the members of the committee, I will be presenting the Safe Voluntary Isolation Sites Program, HSS 22-018, and that this report be received as information and that the Board of Health supports and approves the Haldimand Norfolk Health Unit's application to the Public Health Agency of Canada for the Safe Voluntary Isolation Sites Program. The Safe Voluntary Isolation Sites Program is offered by the Public Health Agency of Canada. The SVISP aims to decrease community transmission of COVID-19 by providing funding for projects that address gaps identified for individuals who are unable to safely isolate due to housing conditions such as international agricultural workers. COVID-19 continues to be a disease of public health significance in 2022. The Government of Canada is focused on efforts to delay and slow the spread of disease and address underlying issues faced by vulnerable populations at higher risk of transmission. The Safe Voluntary Isolation Sites Program, SVISP, is an initiative that the Public Health Agency of Canada has established and will complement other investments and health measures by addressing gaps. The SVISP aims to decrease community transmission of COVID-19 by providing funding for projects that address gaps, as I said, for those who are unable to self-isolate due to housing conditions. The Government of Canada has identified $100 million for the SVISP program as part of the efforts to address the COVID-19 pandemic. The Haldimand Norfolk Health Unit has the opportunity to apply for funding from the Public Health Agency of Canada for the Safe Voluntary Isolation Sites Program that would be of benefit to international agricultural workers, farmers, in both counties of Haldimand and Norfolk. The Haldimand Norfolk Health Unit would like to apply for this funding opportunity. The initiative would support farmers and international agricultural workers by providing a funded safe isolation space that would not be a financial burden to our community farmers and would help mitigate the spread of COVID-19 at our farms and in our communities. In the past, farmers were able to apply for funding directly from Public Health Agency of Canada to receive reimbursement, but going forward, this option is not available. Through the Safe Voluntary Isolation Sites Program, operators with farms in outbreak situations would be invited to collaborate with the Haldimand Norfolk Health Unit to provide international agricultural workers a designated safe isolation space at no cost to the farmer through a reimbursement model. The Public Health Agency of Canada agrees to have quarterly review of funding to meet the needs of the communities of Haldimand and Norfolk. The Safe Voluntary Isolation Sites program provides an opportunity for the health unit to collaborate with partners such as the farming community to ensure effective public health and healthcare services are provided to farms and international agricultural workers. This collaboration will assist in the management of international agricultural workers needing to isolate and mitigate the transmission on the farm. In conclusion, the Safe Voluntary Isolation Sites program will focus public health services required to protect the health of our international agricultural workers and community. The key is to provide safe isolation space for those who are at high risk due to housing conditions, as well as supporting our farming community.
Questions of Councillor Corbett?
Thank you very much. I support the program and probably welcome it for the people out there. My concern, what are we talking about in numbers of offshore labor for Haldimand and Norfolk? And I have to ask too, it's not only ag services, it's in the construction. Is that extended to construction workers as well?
Through the chair to Councillor Corbett, unfortunately, this application is for specifically our international agricultural workers. We have about 4,500 workers in both of our communities, Haldimand and Norfolk. We looked at the percentage of positivity within our normal community COVID-19 rates. And we are hoping that we can mitigate any spread to our vulnerable populations, such as our farm workers. We are hoping to apply for this initiative, and that it will be of benefit to farmers as well, as they won't have to pay for workers who are needing to self-isolate. Thank you.
Councillor Patterson?
Thanks, Alexis, for the report. Just a question regarding the housing. Have locations identified in both counties that could accommodate these folks? Are they going to have to travel out of our area to various cities as they've had to in the past?
No, what we're going to do with this is we're going to follow the British Columbia model, where the farmers will choose the safe space for their worker that is most convenient for the worker and the farmer. And then we will reimburse them for the cost. So if there is a hotel in Haldimand or Norfolk that is more convenient for a farmer and their workers, then we will be happy to reimburse that. Thank you.
I see no other hands, so I'm going to deal with the motion on the top of page 19 of the agenda. Can I have a mover and seconder, please? But Councillor Corbett, seconder. Councillor Huffman, thank you. All those in favor of that motion, it is carried unanimously.
Thank you very much.
So we'll move on to the next staff report, was on page 38, page 022. Regards to the 2022 Haldimand Norfolk Health Unit Funding and Accountability Agreement budget amendment.
Thank you, Mr. Chair. Mr. Syed Shah is going to present this report.
Thank you, Heidi. Through the chair to the members of Advisory Committee meeting, I'm going to present 2022 budget amendment report on Health Unit's Annual Service Plan, Funding and Accountability Agreement. So this report to advise the Board of Health on the outcome of the Annual Service Plan and budget submission. It also provides information on the current public health funding and accountability agreement. To give you a background, the Ministry of Health requires submission of an annual service plan to accompany the request for funding for mandatory and related programs. The annual service plan was submitted to Ministry of Health on April 1st, 2022. Board of Health report HSS 22-05 on annual service plan was presented on April 5th, 2022 for endorsement. The Ministry of Health has communicated the approved allocations through the amending agreement on May 2nd, 2022. So I'll start with the base programs. That's table 1. For mandatory programs, our annual service plan request was $5,431,900, and approved allocation by the ministry is $5,486,300 with an increase of $54,400. There is no change on MOH, that's the /AMOH compensation initiative. For Ontario Seniors Dental Care Program, our annual ASP request was $537,900, and approved allocation was $633,300 with an increase of $95,400. So for base program funding, there is an increase of $149,800. For mandatory programs, increase of $54,400. This funding will be used to offset the levy shared by Haldimand and Norfolk counties. And for Ontario Seniors Dental Care Program, the increase will be used to offset eligible costs within that program, which remains 100% funded by the Ministry of Health. The next one is one-time programs. So in total, staff submitted 8 one-time funding requests, 4 of which were approved. 2 requests from the previous year were extended for another year, and 2 new requests were approved. There was also 2 carryover requests from the previously approved programs where funds could not be utilized during the 2021-2022 fiscal year. If I move quickly to table 5, that's budget amendment summary, that will give you an overview of where we are at this point in time. For base mandatory programs, so approved budget by the Board of Health was $6,073,400, and approved allocation, which we got from Ministry, is $6,223,200. So there is a variance of $149,800. For one-time programs, the approved budget was $616,000. Approved allocation is $950,700 with a variance of $334,700. For one-time programs, that includes COVID general program and COVID vaccination, approved budget was $947,900. And approved allocation is $2,494,700 with a variance of $1.5 million, with a variance of $1,546,800. For one-time capital programs, approved budget was $640,000 and approved allocation is $790,000 with a variance of $150,000. So in total, the approved budget was $808,277,300 and approved allocation is $10,458,600 with a variance of $2,181,300. So this is the amount which we'll be requesting to amend in the budget. I'll quickly go to table 6, that is an FTE impact. So for COVID-19 general program, so approved budget, there was an approved budget of 8.6 FTEs and approved allocation we got is 17.2 FTEs with a variance of 8.6 FTEs. For COVID vaccine program, we got the approved allocation of 16.74 FTEs with a variance of 16.74. And for school focused nurses initiative, the approved budget was 2.9 FTEs. And now we got the approved allocation of 5 FTEs with a variance of 2.1 FTEs. I want to mention one thing is that some of these FT impacts, it represents an extension of positions from June 30th to December 31st. So with all this, I'm requesting that this report will be received as information, and Norfolk Health Unit operating budget may be amended to include this amount. And the Board of Health and the Advisory Committee approves the extension of COVID-19 program staff until December 31, 2022. With this, I am happy to answer any questions.
Thank you, Sayed, for your report. I have two hands up, Councillor Corbett and Councillor.
Thank you very much. It's always good to get extra funding. Two questions with regard to COVID-19. This morning I read an article from Dr. Fauci indicating COVID is going to be with us for some time. Do you see that funding being extended over a period of time? And the other thing with regard to that too, I lost my notes and forgot what I was going to ask. I'll get back to it.
Okay, through the chair to Councillor Corbett. So COVID is going to stay with us for some time, but at this point in time, Ministry is only allowing us to, or has given us funding up to December 2022. But they did mention in their meeting that there would be an opportunity for more discussion. And if there is a need, so Ministry is open for further discussion.
Thank you. And the other question I had was with regard to the not approved projects that were put in. And I'm very concerned, and the numbers we have for mental health and addiction services in the rural area, we provide numbers that are somewhat up. I wonder if you can comment on that $124,200 not being approved. I think it's something that we really need in our rural area.
Thank you. Through the chair to Councillor Corbett. So Ministry did not provide us any rationale why they didn't approve these funding, but they did mention that again, after the election, there will be another opportunity to have a discussion on with every health unit on the requests which were not approved. So definitely we are going to take that initiative again with the Ministry for further funding.
Thank you.
Councillor Hopman.
Thank you, Chair. Through you to Syed. A couple of things. One, so just looking at this, the variance of just over $2,181,300. So are those funds the ones that will cover the 27.44 FTEs?
Through the chair to members of Advisory Committee, that's correct, ma'am.
All right, and my other question is, in terms of on table 6, number 3, the School Focused Nurses Initiative, we had an approved budget of 2.9 and then an approved allocation of 5 for a variance of 2.1. My question is, have we ever had anybody in those positions? Did we actually fill those positions?
Thank you. Through the chair to member of committee. So that's correct. So right now, all those positions have been filled. I'm just looking at the latest stats. So they are all filled.
That's good to hear. Thank you very much.
Thank you.
Yeah, I see no other hands, so I'm going to ask for mover and seconder for the motion on page 38 in the agenda. Mover, please. Councillor Huffman, seconder. Councillor Corbett, all those in favor of that motion? It is carried unanimously. Next report is on page 70, and it is HSS 22023 regarding the Ontario Seniors Dental Program overview and update.
Thank you, Mr. Chair. This is a follow-up memo from the last Board of Health meeting to the last, a follow-up to the last Ontario Seniors Dental Program Report. So I will turn it over to Syed to present this memo to committee.
Thank you, Heidi. Through the chair to the members of Health and Social Service Advisory Committee. So this memo is to provide Board of Health an overview of Ontario Seniors Dental Care Program and an update on activities to date. So if I give you a background, so in 2019 provincial budget, Ontario Seniors Dental Care Program was introduced for low-income seniors. The objective of this program was to prevent chronic diseases and increase the quality of life while reducing the burden on the healthcare system. This program is 100% provincial funding with no levy contribution from the municipalities. Initially, as per Ministry's directive, the program was delivered through salaried dental care providers within public health units or through community health centers or Aboriginal health access centers. In 2019, we received funding of $537,900 as an operational funding for the implementation of program. At that point in time, we didn't have the infrastructure to deliver that program. And in our communities, we don't have any community health centers or Aboriginal health access centers. So staff report HSS 1939 was presented to Board of Health on September 3rd, 2019, where we made recommendations that Board of Health accept the funding and allow us to hire 3.5 FTEs to deliver this program. The Board of Health advised the staff to explore fee-for-service program with local dentists. So we did reach out to Ministry of Health and reported back to Board of Health on September 17, 2019 with report HSS 1942. The Ministry of Health confirmed that fee-for-service reimbursement model is not permitted. However, we may enter into a temporary partnership contracts with the local dentists or service providers to facilitate the launch of the program. Following that, we prepared a modified request for proposal and issued to the marketplace. We got 3 community providers to provide services for Ontario Seniors Dental Care Program. In January 2022, another report, HSS 2002, was presented to Board of Health that we received one-time capital funding of $623,000 to modernize our infrastructure in Simcoe and in Dunville offices. There was a delay in the construction, and then because of the COVID, the construction was halted in March. Construction recommenced in 2021. However, the ongoing COVID-19 pandemic resulted in significant increase in construction and equipment costs, as well as delays in construction work from the frequent lockdowns. So a report HSS 20-13 with staff recommendations was presented to Board of Health to extend the current contracts of community dentists and to amend the 2020 operational budget for capital plans to allow the use of surplus operational funding to support increased capital costs. So we have been providing regular updates to Ministry of Health on our capital projects. And now they has given us an extension for completion of our capital funding expenditure till March 31st, 2023. So construction of a dental operatory at Dunville office has now been completed, and the construction at the Simcoe office is expected to be completed in August 2022. In February 2021, a modified procurement process was issued again to the marketplace. And then we got 4 community providers until June 30th, 2022. You may remember in April, we asked for an extension and again a modified procurement process to extend these 4 community providers up till end of this year. I just want to share some stats with you. So in 2022, from January to April, that is for 4 months, 181 seniors, they have accessed this program with a total visits of 263 visits and a reimbursement amount of around $197,000. In our contract with our community providers, we are paying them an hourly rate. So you will see the dental hygienist rate is from $175 to $270 per hour. And for dentists, it's $375 to $925 per hour. So what we are proposing is at the end of this year, we want to have an evaluation of this program and then come up with some kind of recommendations how we are going to move forward with this program. With this, I'm happy to answer any questions. Thank you.
Thank you, Syed. I have Councillor Patterson.
Thanks, Saeed, for the report. My timing's not very good. I went to the dentist last week for cleaning and a checkup. I should have asked him his hourly rate, but I haven't seen the report yet. Could you expand a little bit that you just mentioned the variance in the rate? To me, even when I look at the lower end of the scale, $375 an hour, it seems excessive. So is there other costs involved in the hourly rate, such as maybe administration or medical dental supplies? Getting into the upper end of almost $1,000 an hour, is that like an oral surgeon? It just seems a big variance in what we're paying.
Thank you. Through the chair to Councillor Patterson. So you are right, like this is what we got through our through request for proposal process. So not many dentists, they applied. So we have to choose from, we have to choose all of them depending on the different areas where they are servicing. But this is the amount like they quoted and we chose them just to provide services for our seniors. So that is one of the reason we want to go for an evaluation. And if there is an opportunity and if the advisory committee and board of health, they allow us, we want to implement in-house model where we would be able to hire a local dentist and a hygienist so that in-house services can be provided, because it seems it's an expensive model at this point in time.
Syed, what's the eligibility age then for this program? Is it 60 or 65?
It's 65 years and it's mostly based on income requirement. If I can double check, but if I remember correctly, it's around $23,000. So if you are, so that's the threshold for income, but it's 65 years.
Okay. So are the majority of the people using this program then, are they on social assistance or not necessarily?
So I don't have that information, but they are all low income people. So how the system works is they have to apply to Ministry of Health, where Ministry of Health is determining their eligibility and they are providing them a card. So once they get that card, they contact the local public health units and then we facilitate them for their services. But I can get that information for you in our next meeting.
If you can, I appreciate it, because I have an individual in my ward who may use the service. Heidi, you want to comment?
Thank you. Just to supplement Syed's answer, through you, Mr. Chair, these individuals would not be recipients of Ontario Works or ODSP because they would at the age of 65, they would transfer from those programs to old age security. So based on the income cutoff, I would assess that most, if not all of the seniors would be old age security recipients with perhaps with the guaranteed income supplement, and that falls within the income cutoff limit.
Okay, thanks, Heidi. And thank you. Councillor Van Passen?
Yes, thank you, Mr. Chairman, and like a follow-up to Councilor Patterson's question. I had the same concern that do the rough numbers, spent $200,000 on 181 clients, that's over $1,000 a person. It's about $750 a visit. And I wonder if it's possible, like, I have no idea whether that's high, low, or indifferent, but I'm sure like Norfolk County has a dental insurance program with employees, and I'm sure Haldeman does. And, is it possible just to sort of look at that and wonder what the average cost per visit through that system is compared to this one, to see whether these numbers are terribly out of whack or whether that's the norm? I have no idea. Like Councilor Patterson, when I go to the dentist, I reach in my back pocket and pay for it. That's the end of it.
So through you, Mr. Chair, to Councillor Van Passen, certainly that's something that I can connect with our colleagues in HR. I think not the other comment, and this would be an assumption, but not knowing the people that we support through this program, but I would suggest that if these are individuals who have lived in poverty most or all of their lives, potentially they have not had access to dental care and preventative dental care. And so at the point in their life where they then become eligible for the Ontario Seniors Dental Care Program, again, not knowing these individuals, not seeing their dental files, I think that there is a possibility that they are having more than a general cleaning. Because their dental care is at such a state that they require more intensive interventions in order to deal with the physical health aspects of having, getting into your 60s or perhaps even older with maybe never having been able to see a dentist.
That was my assumption as well, this making up for a lot of lost time. And yeah, it's expensive, but there is logical reason for that. So it'd be nice to get a little bit of data to show that there definitely is a need for this program. And, it's expensive, but there's a need for it.
Patterson?
Thanks for that, Heidi. And just to follow up, I totally understand what you're saying. That's probably the reality, but it's still back to that initial question of is it per hour rate? I mean, even if it's extensive, like maybe an oral surgeon is at $9.75 an hour, whatever. It'd just be nice to kind of see, is it $3.78.5 an hour for a simple cleaning, or a bit of a breakdown? That's all.
Okay, I see no other hands. The motion to receive this report is on top of page 7. You can have a mover and seconder. Councillor Patterson has moved, seconded by Councillor Van Passen. All those in favor of that motion? It is carried unanimously. On to the last staff report on page 74, 22019. It's in regards to the Canada-wide early learning and child care agreement funding budget amendment.
Mr. Chair, it's my pleasure to introduce to committee Ms. Jennifer Snell. She's the program manager with Children's Services, and she's going to be presenting the report today, and with us as well as Stephanie Rice to assist with any questions.
Thank you. Through the chair to the members of the committee, I'm happy to be here to speak to the Canada-wide Early Learning and Child Care Agreement. The recommendations are that Council receive this report as information, accept the CWELC funding, and amend the levy-supported operating budget as outlined in the report. We are very excited about this agreement between the federal and provincial government and the positive impact we anticipate this funding and the new CWELC system will have on families and childcare operators in our communities. Funding under the CWELC agreement will be used to build upon the existing early learning and childcare system by increasing quality, accessibility, affordability, and inclusivity. The initial year rollout for the CWELC system will be a year of transition. By taking a phased approach, the Ministry of Education's immediate objectives in year one will be focused on affordability for families and as well as system stability. We anticipate that future phases will address increasing accessibility and inclusion over the longer term. As laid out in the report, the initial phase consists of implementing a 25% fee reduction retroactive to April 1st, 2022 for children 0 to 5, with an additional reduction planned at the end of December 2022, as well as workforce compensation to increase wages of eligible childcare staff in alignment with a newly established provincial wage floor. We are currently working closely with the Ministry of Education, other municipalities, as well as our finance department to develop an application process, policies and procedures, enroll and fund interested licensees in Haldimand and Norfolk counties. I'd like to open it up for questions now.
Okay, thank you for your report. Any questions from committee? Councillor Patterson?
Thanks for the report. It's not a question, just a comment. I'm very happy that the provincial government has finally got on the affordable childcare bus. So it's a long time coming. So job well done. Thank you.
Any other questions for committee? Certainly good news. Thanks very much for your report. I'll deal with the motion on the top of page 74. Can I have a mover and seconder for that report? Councillor Corbett and Councillor Huffman. All those in favor? It is carried unanimously. Councillor Corbett, did you get a chance to ask those questions that you had under business? You're okay. So as far as I'm concerned, we're dealing with adjournment. Heidi, unless you have anything else bring to our attention. Motion to adjourn at 10:33. Moved by Councillor Huffman, seconded. Councillor Corbett, all those in favor? It's carried unanimously. Thank you. Thank you.